the very brief idea of a superficial idea of prevention could be reducing the kleda or the unwanted moisture inside the
Yes, because
oropharynx, nasopharynx.
this is all part of what Ayurveda would call as Prakriti Vikhada. Krimi Chikitsa,
Of Kriti.
Prakriti Vikhada is a, you know, not providing the kind of favorable substratum for the krimis to multiply and spread inside the body. Apart from that, there are other interesting things also mentioned, like, non-medical measures, like Sushruta clearly mentions sthana parityaga, that is going away from the location where so this is like containment, restricted entry, and Charaka says hitanam cha pradeshanam upasevana. So Sushruta says sthana parityaga and Charaka says relocation. Charaka also talked about Gupti Ratman, Atma Gupti. Atma Gupti means self-isolation and protection. So these kind of measures have also been mentioned. And actually the system of quarantining, the word quarantine is coming from an Italian tradition. There is a understanding that this was probably first, practiced in the Arabian nation, but this idea of quarantine came from Italy during that plague and all those times. But in Nepal, thousands of years ago, quarantining was practiced as part of the Ayurvedic tradition. So people who went out on trade and all that, when they came back, most of the time they came back with infections. They were not allowed to come back into society for a particular period of time, 2 to 3 weeks, almost about a month. Only when they came back and it was found that they are not sick and they are healthy, they would be allowed to even go back to their families. So these kind of non-medical public health measures have also been described, in our texts or sometimes in the traditions. So all these things need to be revisited. That will give us really very good insights on how systems like Ayurveda have understood and have tried to suggest strategies from different perspectives to deal with these pandemics.
So also we have certain description of dhupana also, and there are many practitioners who are actually practicing this dhupana in their clinics and at their places. So we know that dhupana has not just the physical impact, but also it has been mentioned in the Graha Chikitsa. So it has some sort of a metaphysical impact also. So how can we? So will it work in both spheres in COVID context?
Yeah, I mean, the dhupanas are usually, we are also doing it, it has an effect on your mind. So when you say graha, in my understanding, it has got to do with psychological, elements, disturbances in your mind, which your mind gets hijacked by, this is what we call as graha. We are hijacked by our own emotions. And that is why that's called as grahavesha, that you lose, control of the situation. So calming the mind, keeping the mind at a level of sattva guna. So it is when you have a dominance of rajas and tamas. Rajas and tamas are, turbulences in the mind. They are modes in the mind in which you are more under the control of your emotions. Whereas in a sattvic state, the mind is, in poise. And the intelligence, your actions are based on conscious choices, informed decisions by applying your intelligence when you're in your sattvic state. But when you're in a rajasic or tamasic state, you're overpowered, you're hijacked by your emotions. So all these practices in Ayurveda, because we consider the body and mind as one continuum, we don't completely separate. We don't treat the body alone or the mind alone. So this is very, very common that all our treatments, have this dual dimension. It will have a physical effect and also a psychological effect at the same time. And in COVID-19, this will be very effective. One of the things is most of the modern methods of disinfection, sterilization, like fumigation, which is where we use formalin and other poisonous substances, they have a lot of toxic effects. Whereas these dhupanas and other procedures are much safer, and they have other health benefits also. They have a very pacifying effect on the mind and calming the mind of the individual. That is what we mean by when our mind is pleasant and when it is focused on constructive, positive thoughts, then your mind can no longer be hijacked by these negative emotions. And this is also the feeling that we get even when we put a dhupana or burn these incense sticks. Our mind becomes immediately calm and peaceful. So that effect is definitely there. But the question whether these kind of dhupas like aparajita dhupa can destroy SARS-CoV-2, that really requires some study. I mean, we cannot make that claim. It's known that it is able to reduce the microbial load in air samples, but no, not yet a study has been done on SARS-CoV-2. Now, SARS-CoV-2 is also known to remain on surfaces. There are many theories about this, on different types of surfaces that it can be remain there. So surface cleansing will also be a very important factor in controlling the spread of the virus. So these are areas where some interesting exploration could be done. And then we could also introduce dhupana and all those things into the preventive measures that Ayurveda can offer.
So, what role does the right diet play in either in maintaining the non-vulnerability of the body, or even if contracted with one, how can it, or what is the significance of the right diet?
See, according to Ayurveda, the efficiency of the body is based on ojas. Ojas, we sometimes wrongly equate it with immunity. It's not just immunity. The modern concept of immunity is very mechanistic. There is this innate immunity, adaptive immunity. In my understanding, this kind of immunity comes more close to the Ayurvedic concept of Agni rather than Ojas. Because Pachana, and those are the things that this innate immunity means, phagocytosis, all those things, which are part of the Agni system of the body. So, Ojas is, efficiency, where your system is responding. It's very resilient and is able to, face the stress in a very efficient manner. So, for your system to face and overcome an infection, many things are required. Agni is very much required. And that is why diet is given a lot of importance. We have to preserve our Agni. When you look at Jwara Chikitsa, the first principle is, increasing Agni. Lankanair chapite doshe, deepte gnau laghave sadi, swasthyam chutrit ruji pakti, balam ojas jayade. So you are telling that. So when you say diet, people think you must eat a lot of things. And in Ayurveda, we are saying that not eating is also part of diet. Not eating unnecessarily is very, very important. In fact, today, the last Nobel Prize, one of the Nobel Prizes for autophagy, is talking about this concept in Jwara, where Lankhanaihi, by restricting intake of food, you are actually activating. Balam ojas jayade. You are activating your immune system. Now, this new findings say that if you fast for 2-3 days, you are rebooting your whole immune system. So that's one thing. The second thing is the food that you eat should be, your system should be able to deal with it. You should be able to digest it, and you should be able to completely metabolize it. If there is an error, a stress on your digestion or on your metabolism, however much nutritious it is, it's not going to help you. It's going to put your system in stress. And that metabolic digestive stress is what we call as ama. Ama. That which does not move. Ama means that which is not moving, that which is not transforming anymore. So eat a food that is, completely digested, transformed, and becomes part of, not only your physical body, but also your mind. It's very, very important that you also eat food that is, delicious. Charaka says, Pathyam pathona pedam yat yachchavi manasa priyam. So in the name of diet, we think we must eat all tasteless foods, only which is having nutrition. Then you will go into depression.
So also you mentioned about the PPs that I feel doctors and the nursing staff that are using these PPs, maybe the Vega Dharana, so that could also play an important role in making the person vulnerable to such.
True, I mean, yeah, but it's always a risk benefit ratio thing. That does not mean that you should avoid. And also, there is very little understanding of what kind of protection needs to be taken. So there's still debates on whether masks are useful or not. This shows our ignorance about the disease and the way it spreads. So we have to take the benefit of doubt and work in the interest of the people. So in the name of Vega Dharana, if you don't wear any PP, then you might even end up in ICU few days later contracting the disease. So it's very difficult to take decisions at this point. And doctors are actually doing a sacrifice. I mean, they are risking their own well-being. There are horrific stories of, when you say Vega Dharana, it actually means suppressing the natural urges. So that can actually have a impact on your whole physiology, and that is how it can lead to many diseases, especially urination, because being inside a air conditioned room and not I mean able to kind of, you also drinking fluids and not able to I mean urinate can be extremely challenging. And according to Ayurveda, this can cause very severe vata disturbances in your system. And then sleep, many other Vegas, natural urges like sleep. Sometimes you're not able to sleep in time, and all those things can have a telling impact on the immunity of the doctor himself. So we need to make sure that there are good shifts. We need enough number of people so that individuals are not, under too much of stress. Plus, wearing these PPEs also damage the skin, especially on the face. We have seen so many, really frightening pictures of doctors when they remove the PPEs. There are bruises on their face, and when you really use these tight things. So that is there, but we don't know. This is the challenge. And many of these PPEs are of very poor quality. They are like raincoats. So there is no breathe, it cannot breathe. So you are really suffocating inside. I mean, your skin is really affected. So it's not a very ideal condition to be working in COVID care hospitals.
So now that we know that there are quite a lot of hurdles in bringing Ayurvedic medication to forefront as a replacement to the modern system. So what can Ayurveda do when we talk of prevention in terms of COVID-19?
Yes, I mean, in prevention, especially even non-medical dimensions are very important, like, social distancing, wearing masks, doing all those other social practices, which are extremely important, that we have to accept. That's common for both modern medicine and Ayurveda. Even Ayurveda would agree to that. That's, I think we discussed some time back in our conversation also about how Charaka Samhita says that you must choose places which are safe. And Sushruta tells to move away from places which are very risky, like the containment zones, isolation. Charaka also talked about Atma Gupti, Guptiratmana, self-protection at this time. So all those preventive measures are very, very relevant. External sanitization, things like that. But when it comes to the personal, level of medical aspect of prevention, there are many things that, from an Ayurvedic point of view, could be potentially helpful. One is, of course, the simple practices like dhupana to keep our environment around us, safe. Because the microbial load could potentially be reduced by doing some of the dhupanas. And Aparajita dhupa is very famous in Ayurveda. And in Kerala, recently they did a study with Aparajita dhupa during the pandemic. The only challenge was that they were able to find that it does reduce microbial load and keep the atmosphere sterile for some days. So that's quite good. I mean, you don't even need to do it every day. But the only problem here is that, it's very difficult to study directly on SARS-CoV-2 for the reasons just I mentioned. These that we don't have access to this virus. We don't have access to models where we can directly try on this virus. So that question remains unanswered. Whether this Dhupana will specifically work on. But I feel that we should give the benefit of doubt. I mean, why should you? It has got other benefits. So as long as you don't count on it to 100% eliminate SARS-CoV-2, it will be a good practice that we can bring into our society in the name of COVID-19. If Abharajita Dhupana becomes part of our culture and the life now, especially during rains, if not even COVID-19, we could eliminate so many other diseases, keep our atmosphere more germ-free. So for that, so many of these preventive practices in Ayurveda that we are going to recommend on the name of COVID-19, even though we may not be able to prove specifically that it is working against SARS-CoV-2, adopting them has other benefits. So for that reason, I would strongly recommend that we should use them and study in the process whether it has a very specific effect on COVID-19. Now, another practice is nasyam gandusha, which is mentioned in Ayurveda as a part of our daily routine. And this nasya gandusha, gargling. The nasya is, of course, applying medicines in the nose. And gandusha is, gargling. I mean, where you're holding, not just holding, we need to actually gargle and clear our throat. Now, these are practices using, this hypertonic saline solution, povidone iodine, even some mouth washes. There was recently a study which showed that some of the mouth washes are able to make the mouth completely free of the viruses, at least for a short period of time. In Korea, South Korea, I think they found that a particular kind of mouthwash was able to prevent viral shedding for 2 hours or 3 hours. So if when you are going to meet some people or when you have a clinical consultation, you could ask the patients to do this gargling and go so that the spreading is avoided. So these kind of practices, Ayurveda offers a lot of herbal solutions, which may have, because modern chemicals are very harsh and harmful, and if you have to do it for a long period of time, it can produce unwanted effects. So here we could definitely look at the solutions that Ayurveda offers. The interesting thing about Ayurveda is it will be not just COVID specific; it will have other good side effects also, as you can see. Whereas in most of the modern drugs, we are afraid of the unwanted side effects. Here we have many positive additional effects because it changes the way you take care of your health. You bring a new routine into your system. And this nasya, kavala, or gandusha is something which you can continue even post the pandemic. So these are some practices.
So you mean to say that the preventive aspects or the preventive measures that Ayurveda propounds could not only protect us from this COVID-19, but it has a broader positive effect. So what are some of the dietary and lifestyle modifications that people can adopt in their lives?
Yeah, I mean, everywhere there are some general practices which we can follow, whether or not it helps COVID or not. But I'm quite sure it will play a role in improving our ability to cope with this infection, even if we were to contract. I will not say that these measures will work like a magical vaccine and make us totally free of COVID. No, we have to follow. That's why I told about the other measures like social distancing, wearing masks. There's still debate going on. How effective the way we wear it. All those things are there, but All those things are still necessary, even if you follow an Ayurvedic method of prevention. But the thing is that these practices confer what for lack of a proper word, I'm saying something like kind of a natural immunity, a natural ability to cope with infections. And that can be greatly enhanced. So that benefit is there. So I'm sure till we prove that it has got a COVID specific efficacy, we cannot claim anything. But I'm sure it will have its bearing on our ability to deal with COVID-19 also. So here in Ayurveda, we say the body and mind, they have to be fine-tuned. You have to bring the system to a state of balance, which according to Ayurvedic terms is the balance of the doshas, balance of Agni, and the production of ojas in the system, balance of the mind, the trigunas. When we are not in a stressful state, the resources of the body are fully available for us to fight an infection. So even if an infection occurs, the chances that we will fight it successfully is very high. This is what Ayurveda offers. And not people think that if I take some ashwagandha or if I take some chavanaprasha, I may not get any infection at all. Uh, Ayurveda does not offer you such a guarantee like a vaccine. But it definitely tells us that we will be better prepared to face that infection. So even if the infection happens, it may be very mild, you may be asymptomatic, or even if it becomes a full-blown disease, you may not progress into a very critical or severe stage. So here, that is why diet also becomes important. And diet, in according to Ayurveda, basically Agni has to be preserved because Agni is also part of our immune response from an Ayurvedic point of view. This pachanam, this concept of pachanam, which means to digest, is not just cooking food. It is cooking, digesting all the unwanted, even foreign substances that come into our body, which in modern science we call as innate immunity, phagocytosis, and all those digestive enzymes which destroy the bacteria. This is part of our Agni system. So not keeping the Agni in strain, keeping the Agni in a stable condition. So samadosha sama agnischa, samadhatu malakariya, that concept. So that is where diet is very, very important. So I would say the first thing in diet is don't disturb your Agni. Rather than thinking that I take more and more nourishing food, this can be very dangerous in COVID time also when you don't having exercise and eating a lot. So eating a lot will not improve your immunity. Eating correctly will stabilize your immunity. So there it's very important. So it's very important to avoid all kinds of junk foods. Vidahyanam, which we say. Viruddhan. All these modern foods that we get in the bakeries, they're all viruddhana. So Vidahyanam, Viruddhanam will trigger the inflammatory pathways. It will put our immune system into a hyperdrive. In fact, I feel, in my understanding, if we follow a very nice organic diet, Agni friendly diet, the immune system will be calm. Most of our today, one of the problems with COVID-19 is the immune hyperdrive. The immune system is overactive. And it is, we don't realize that the foods that we eat, the unwholesome foods that we eat, actually make our immune system hyperactive. Allergies are nothing but a hyperactive immune system. The inflammatory response is nothing but a hyperactive immune system. So the roots of such a some of the reasons why some individuals, even who are young, sometimes they have a hyperdrive of the immune system to COVID-19. It could be due to so many of these factors. They are not fully understood. So diet is extremely. I'm not going to give a item by item, list here of, but I'm just talking about in category. So avoiding food late at night, you know, reducing the intake of your meal to really what is necessary for you, avoiding all that extra food, the snacks and the junk foods, and that will make a big difference in toning up your system to face this kind of challenge. So eating, if possible, only 2 meals or just 3 meals a day, avoiding in between snacks, avoiding junk food, eating a lot of vegetables and fruits, and that's also according to the season, according to your constitution. So for these things, people could get some specific advice from an Ayurvedic clinician. It's not possible to give general guidelines. so they can assess their prakriti and their particular condition. And a good Ayurvedic physician can counsel them and give them a kind of customized dietary plan. This, I think, will definitely support their system. Yes.
So you spoke about customizing the diet. So diet also could be helpful when it is prescribed, looking into different conditions in a person. So the same goes with the so-called immunity boosters that we are talking about. So that also need to be essentially customized.
Yeah, the herbs, you mean the herbs that we
Herb.
are talking
Yes.
about for preventing. Yes, in my opinion, it's also not advisable to just give one herbal combination to everybody. That's not, because in Ayurveda, if you look at some of the paniyas, what we call, these are all paniyas. Uh, so although sometimes they are called as kadha and all that, I mean, they are basically coming under the category of paniyam, medicated paniyam.
Water.
So aushadha paniyas. So they should be actually customized depending on the season, depending on the individual. So we have to give options. So there is Sadanga Paniyam, which will be actually very helpful in the summer season. Now the Kapasura Kudinir, that word Kudinir in Tamil also means drinking water. So it's very, very important that these medicines are given in the form of drinking water, not necessarily as, concentrated kashayams. Because those concentrated kashayams can deliver the chemicals in a much more, concentrated form. And then we cannot predict what changes will happen. So this kind of medicated drinking water has been part of the Kerala tradition. As you must see here, people use this. There are different combinations that they use in different seasons. In Kerala, infectious diseases come during rainy seasons. We know that many diseases are here. So I think we should have at least 3 or 4 such combinations. Some on the cold side, some on the hot side, looking at the dosha combination and the seasons. And then some guidelines on how people can choose the right combination, based on their, peculiar conditions. Definitely, I think this needs to be more flexible and customized. And just advising one formula.
So we also do know that stress also plays a very important role in optimizing or making you vulnerable to different conditions. So, what is the influence of mind or the role that stress plays in keeping the body intact or to remain healthy?
This is a very fundamental thing in Ayurveda, that body and mind are interrelated. So we compare this to the ghee and iron pot. So when the iron pot is heated, ghee also get heated. If you pour hot ghee into an iron pot, the iron pot also gets heated. The body and mind are in Ayurveda so closely interrelated. It's like one continuum. And today in modern science, we talk about PNEI axis, psycho, neuro, endocrino, immunology, which means there's a crosstalk between the body and the mind. And the immune system is influenced by the mind. That's what this PNEI axis is talking about. So although we cannot make a one-to-one correlation, it just struck me one day that PNEI axis is just a modern way of telling manas and vata pitta kapha. Because P is for psycho, which is a manas. N is for nervous system, neurology, which is vata. E is for endocrinology, which is pitta. And I is for immunology, which is like kapha. So when they talk about PNEI axis, it's just a rediscovery in modern scientific terms of a very fundamental axiom in Ayurveda, that body and mind are interlinked. So any small change that happens in our mind influences our nervous system, endocrine system, and our immune system. So that is why it's very, very important to remain mentally very peaceful. So when you are mentally peaceful, there are so many chemical changes that happen in your system. Endocannabinoids, GABA, anti-anxiety molecule called GABA is produced when you're practicing yoga and such other things. And especially we call in Ayurveda as the Ida Pingala balance, in the Sushumna, which is very similar to what modern science calls as sympathetic parasympathetic nervous system. We cannot make one-to-one correlations exactly, but broadly I'm saying. So that is what breath control is, to control the balance of Ida and Pingala. And if you are in a, and the Ida and Pingala are hot and cold, so this is again, sympathetic nervous system, which is an aggressive system, which activates when you are under stress. But the parasympathetic nervous system is when you are relaxed. So it's very, very important that your system is predominantly in a relaxed state for your immune system, your endocrine system, all this to function, in an optimal way. And so not being stressed. And this is very important because the pandemic itself is creating a stress. So even if we are, not affected in other ways, we have the best nutrition, the best medicines. Stress alone can actually, bring down our immune system in the times of this pandemic. And whereas if you are mentally stable, calm, and relaxed, it will definitely ensure that you have a immune system that is much more active and much more robust. So all these things need to come together. That's what Ayurveda tells. It's not just you drink some, medicated water and your immunity is boosted. No, none of these things by itself may be sufficient to give you immunity during this COVID-19 period. So some people may say, I was drinking this medicated water for so many months, and if they are not sleeping well, if they are stressed, if they are eating junk food, then this alone is not going to help. So I can almost say it's like an all or none principle, as we say in Ayurveda. You do everything, you get the benefit. Otherwise, you don't get anything. Just by following one of these things, you don't get it. So Ayurveda is coming to tell you to transform yourself to a higher level of function. And that is what makes the Ayurvedic approach a modern approach very different. People are dreaming of one vaccine. They are more interested in the vaccine because the vaccine will still allow you to do all the things you want to do in your life. Without changing yourself, you can eliminate the disease. So that is why modern medicine is also more powerful. So you get an antiviral, you swallow it, and the virus is gone. But in Ayurveda, it's not like that. Ayurveda really puts you to task. I mean, because it tells you now change your lifestyle, wake up early in the morning, eat that, eat this, don't eat that. All those things, make a big difference.
So people also have this impression that if they are taking these herbs, so in any form, so like we also see Chavanprash ice cream and Ayush Kvata chicken, so immunity booster breads. So they also have this false impression that they can do anything they want, and they can remain safe and if they are taking this the herbal preparations.
I would like to kind of put this in right perspective. In Ayurveda, we do have the system of medicating foods. So, apupas, even when we want to give a virechana, or in Charaka Samhita, there is even a description of what is very similar to an aerosol, where, a king who doesn't want to take this tasty food, it's made to smell a flower and then he will get vomiting. Or so put the medicine in a flower and give. So this approach is there. So to some extent, as long as we follow some principles, medicating food is not a bad thing. In our tradition, we had also these kind of eatables. Different seasons people would have different types of eatables. They were not always so tasty because so it should be made hitam. So why I don't want to dismiss these things, offhand, but when ice cream itself is harmful, uh, so using that kind of very, very harmful or junk foods into, just adding a bit of Chyawanprash or Ayush Kada will not make a big difference. But on the other hand, it would be good to look at some of the Ahara Kalpanas in Ayurveda, which can be fortified with medicines. So in temples, they had these special types of mukkudis, as they call in Kerala, which are actually khalam. Khalam, khala is a type of preparation like soups and, yeah, made preparations with buttermilk which are medicated. So there is a scope for that. So while I dismiss these modern fancy things, I would also like to point out that it is definitely possible to fortify foods with medicines. But then they have to be done on the basis of sound principles. Otherwise, it will not be helpful. So these modern methods of chocolate, biscuit, they are not fitting into the Ayurvedic concept of our ahara kalpana. So just adding a few herbs or medicines will not, help us to eliminate the bad effects of those foods.
So, what is the right way of exercising, sir? So, which could protect us from such kind of diseases?
Yeah, I mean, today modern medicine has also come to the understanding that moderate exercise is actually helpful for us. Here, there is a good convergence. In Ayurveda, also, we have said, Ardha Shaktiya Nishevyastu, Balibhi Snigdha Bhojvi. So, Vyayama is Ardha Shakti. So, we have to do exercise only to half of our capacity. And the studies have shown that moderate exercise enhances immunity, whereas over exercising actually reduces it. So this is very much supporting the Ayurvedic idea of, we have this famous verse, Vyayama Jagara Adhvastri Hasya Bhashyadi Sahas Gajam Simha Iva Bhajan Ati Vinasyati. So one of the things which actually has a detrimental effect on your system is Vyayama or exercise, which when we do in excess can actually cause a deleterious effect on the system. So moderate exercise has been known to activate a lot of components of the immune system in fighting infections, and even for cancer. There are studies where they took up the serum of people before and after exercise, and then cultured cancer cells. And it was found that after exercise, cancer cells are not able to survive in the serum of the individual. But in the pre-exercise state, the cancer cells are thriving. So, which means that even for cancer prevention, doing regular moderate exercise is very, very helpful. So, as again I said, exercise alone will not help. When you do all these things that Ayurveda has talked about, then you put your body into a state of optimal health where you have ability again, not only COVID-19. So, all these things that we are talking about as prevention in Ayurveda is not only going to help you if people really follow this during COVID-19 period. I can say definitely that the mortality of not only COVID-19, but mortality from heart disease, mortality from cancer, mortality from so many other diseases, morbidity from other diseases like rheumatoid arthritis, autoimmune diseases. All these things will get reduced if we follow this preventive measures that Ayurveda has to advise during COVID.
So, what is the role of sleep? So, we also have this day sleep and remaining awake at the night. So, what is the exact influence on our body?
Yes, the body sleep is a process through which the body repairs itself, both mentally and physically, and it's also very important. Quality of sleep is actually the most important thing, not just the quantity. A lot of people today are facing challenges in getting good quality sleep. Now, many of these new gadgets, like the watch that you're wearing, is able to track your sleep, and it can tell you how many times your sleep got disrupted, how much time you were deep asleep. To some extent, it is possible, and how deeply you sleep, determines how well you are refreshed and how well prepared you are to meet the challenges of the day. It's very, very important that we sleep at night because by around 10 p.m., 9 to 10 p.m., the melatonin levels in your body increase and it peaks. So body is naturally trying to put you to sleep. So 10 p.m. to 2 a.m., in my understanding, is the most critical time for repairing of the system. This is the Pitta Kala actually. According to Ayurveda, that is the Pitta Kala. I've always wondered how in midnight it can become Pitta Kala because it's night. In the middle of the night, you're saying Pitta is dominating.
Mm.
So if you really look at it, if this Pitta is different from the Pitta in the afternoon, because this Pitta is repairing the body. It is, it is putting back. So this is the time when all the organs,
Mm.
the metabolic ways are all processed, all the repair work happens in the system. So if you are awake at this time, you will not allow the body to be repaired. In fact, midnight is also a time when you can actually be mentally active. So that is why this phrase "burning the midnight oil" has come. I've also noticed if you overcome sleep at 10 p.m. and then you become very awake and very alert because it's Pittagala. So up to 2 a.m. actually you can do a lot of work, but you don't realize that this is at the cost of the maintenance of your system. This period, 10 p.m. to 2 a.m., is called as Kali Yama. There are many yamas. So Kali Yamam. After Kali Yamam comes Saraswati Yamam, then Lakshmi Yamam, then Jeshta Yamam, then Parvati Yamam, then Durga Yamam, then Kali Yamam. So Kali is, we know Kali is that goddess who cuts your head, holds your head in her hand. So it means, so this is very symbolic here. And Kali is the dark one. So it's an interesting coincidence that melatonin is the dark hormone. It's called as the dark hormone. So that point of time when melatonin increases, the dark hormone increases in your body is the point of time of Kaliyama also. And what melatonin does is also very similar to Kali. Melatonin just makes you asleep. It just cuts your head, cuts your awareness. So it makes you unconscious actually. And it is like a repair work is done while you are asleep, and body doesn't want you to interfere at that time, because the moment you are conscious, the stress mechanism activates and the body cannot repair itself. So of all the times that you must sleep, it's not 8 hours or 7 hours. Sleeping at this critical juncture is very important. Then you wake up more refreshed and more active. Waking up in the Saraswati Yamam is also very, very important. Before the Saraswati Yamam ends, that is the time when Sattva Guna is increasing in the system. You are most at your basal state. So if you start your day being at the basal state, it's very easy for you to come back to that state of balance. Because when you wake up in a state where you're already, disturbed and in imbalance, then you are defining your baseline itself as an imbalanced baseline. But if you wake up at Saraswati Yamam, you start with a very calm, balanced baseline. So it's very easy to come back to that state throughout your day. So this is very, very important. And finally, you must train yourself. Two things Ayurveda tells is the sign of good health. Swapna sukhena pradibodhanam cha. Sukhena swapnam. You must be able to fall asleep very easily, not lying in the bed, rolling that side, this side, getting up again, sleeping. A sign of good health is that you fall asleep. Just when you're on the bed, you are asleep. And sukhena pradibodhanam cha. Similarly, you wake up just like that, not pressing the snooze button again and again on your alarm and taking that extra 5 minutes. If you are able to do this, then it means that your body is, in balance. So learning to sleep is very, very important. How to sleep. So today people talk about 7 hours, 8 hours. It's not at all that. It's how deep you sleep and at what time you sleep, what time you wake up, how you wake up. All these things have a bearing on your system. And this is also very generic. It may not be just very COVID specific, but it has additional benefits on other diseases. So when you put all these things together, sleep, exercise, diet, then all those other, cleansing practices, the medicated water, all these things have the potential to completely transform your life and take us to, a more healthy existence.